presenters here. I know a lot of you have asked me some questions about these services, so I'm going to invite them to speak to you about student support services. Our presenters represent lots of different areas. Dr. Langevin, who was here earlier at the introduction, monitors this area and works very closely with this team of professionals, and they're really outstanding. So I will turn it over to Cherry.
Hi, everybody. Welcome to UNE. I'm Cherry Baker. I'm a nurse practitioner, and I'm the Director of Student Health Services for the University of New England. We have a Student Health Center on both campuses, the Bedford campus, we're over in the Pet Center, and one on the Portland campus as well. So we work very closely with the students. We provide a very comprehensive degree of health services, very much like your primary care office at home. A lot of students use us for the primary care services, particularly graduate students when they're away from home. So it's we diagnose and treat and order tests, and we have lab capabilities, and so we're really very comprehensive. So it's not like going to the nurse's office. We really have a functioning health center. We do have a medical consultant that we call on occasion if we need that level of expertise, but we really function very independently with nurse practitioners on both campuses. So some things that you might be interested in, and I have some handouts which I will have down here in the front afterwards about insurance. We do bill for our services. We don't charge the students any money out of pocket to come and see us, so we don't charge a copay or anything like that. But we do bill for our services, so you'll want to check with your insurance company to make sure that they will cover our services here at UNE. Some insurance companies require a referral if it's an HMO or some other type of payer service, and you can get those referrals ahead of time from your primary care office, so it makes it easier for your student if they get sick and they need to come over and see us. Make sure that you send your student to school with a valid insurance card that we can copy, or send them with a copy of your insurance card, both sides. And it just makes the process easier for them. And if your insurance will not cover your student while they're here at UNE, we do have an insurance plan through the university that you can look into through your student account. So just let me know if you need more information about that. We can help with chronic illness management if your student has a chronic illness such as diabetes or something like that. We can do lab tests and forward those to your primary care or specialist office. We are open regular business hours and Tuesday and Thursday evenings until 6:30 for students whose schedules are packed and can't get over there during the day. We're open until 6:30, 2 evenings a week. We do have 24-hour, 7-day-a-week coverage with a live nurse triage line. So they actually get a live person who will advise them about what to do about their health issue. There is an EMS team on campus, and Biddeford Emergency Services is just minutes away. The hospital that we most frequently utilize is Southern Maine Healthcare, and they're about 15 minutes away. So that's what we have for healthcare services. We are the department that's responsible for tracking and keeping records of their immunization requirements and compliance. So if your student gets an email from Student Health Services or anything comes from our office, please don't ignore it, because we're just trying to make sure that their compliance is smooth and that transition goes well for them. Health professions compliance requirements is greater than the general requirements for College of Arts and Sciences. So, and if you have any specific questions about that, just see me afterwards or call our office anytime. We'll be happy to help you out with that. Okay? All the forms that they need, and they're due by July 1st. All the forms are on our web page. You may have gotten some this morning when you checked in from Dawn. One of my medical assistants was at check-in this morning. But if you have any trouble with finding the forms or getting them filled out, just call our office and we'll help you with that. If you're unable to get an appointment with your primary care prior to July 1st, don't worry about that. Just let us know that it's going to be a little bit later. The paperwork's going to be a little bit later coming in, just so that we know ahead of time, and we'll make that happen for you. Sometimes it's hard to get in a timely manner for a physical and get all that paperwork filled out, and we understand that. But, a lockbox for medications if they're coming to school with medications of any kind, but particularly medications for ADD or ADHD, they should come with a lockbox that they can keep those secure. We do have a pharmacy, a local pharmacy that delivers prescriptions to our health center. And you have some information about that particular pharmacy in your packets. If you need further information, let us know. But they're a local pharmacy. They deliver to us 3 days a week. So if your student has ongoing medications that they'd like to get locally, or they're not going to come with a car, that we can make that happen for them. Okay? We have a registered dietitian that provides services. We have a psychiatric nurse practitioner that provides services. So we're pretty well-rounded and comprehensive. And I'll be here afterwards if you have any questions. I have some business cards, and I have the handouts about your insurance plan. Okay?
Can I just ask a question about the referrals you said?
Sure.
Because normally when you call a doctor's office and say you're getting referred to a surgeon, they want the specific date you're going to a surgeon for the referral. Are you saying for them to have sort of a general referral from their regular doctor at home?
Yeah.
Okay.
Tell them they're going away to college, and could we have a referral for 6 visits, or
Okay.
5 visits? And they usually will do that without any problem.
Okay, great. Thank you.
And this handout has our NPI number, or National Provider Indicator number, and that's what they'll need.
Okay.
So if you have an HMO, you will want to get one, because then it has our NPI numbers on it. So that will be what they'll ask for.
I'm Cynthia Curry. I'm Coordinator of Disability Services here in Biddeford. Our office makes sure that students who come to UNE with disabilities, they are provided with equal access and full participation in all academic programs, residential and education life, and any on-site or off-site activities, extracurricular programs. So if you have a child who has received accommodations in the past for any number of disabilities, could be a learning disability, attentional disorders, mental health conditions, chronic health conditions, physical disabilities, we also are obligated to provide accommodations for students. We provide some of the same types of accommodations that students may have received in high school. In the post-secondary setting, not all of those accommodations will transfer. If you have a student who you would like to pursue accommodations for, we can talk about the differences in accommodations and disability between K-12 and the post-secondary setting. But a lot of the accommodations do transfer. So the typical accommodations we provide include extended time on tests, tests in a quiet space, peer note-taking. We have services related to providing textbooks and other instructional materials in alternative formats, such as digital text, audio, braille. So any number of those are typical types of accommodations for students with disabilities. We do require current comprehensive documentation. So any testing, neuropsych, educational psychological evaluations that your child has had in the recent past will be very helpful. IEPs and 504 plans are certainly welcome, and we review them and we consider them in the process, but those are K-12 documents, and we need more information that's more specifically related to post-secondary academics. Your child's the functional impact, their current functional impact on their academic performance, so that we can make some well-informed, appropriate, and reasonable accommodations. All of our services, communications with students are confidential. So in some cases, depending on the accommodation, faculty will need to be informed that the student has an accommodation, but nobody outside of our office or anybody else on campus that may need to know about your child's disability. Within disability services, the disability needs to be disclosed to us, and we have an interactive process to determine accommodations. Beyond that, faculty may need to know that your child has an accommodation, but they don't need to know what the disability is. It's completely up to the student to disclose their disability to anybody else. So students tend to like to know that things are confidential. A lot of students come to college and they want to be free of their accommodations. They think that, you know, maybe their attentional disorder graduated when they graduated from high school, and then they come and they think, you know, I don't want my accommodations anymore. I want to fly free. I'm in college now. And sometimes that works, and sometimes it doesn't. And when it doesn't, it can turn into a crisis situation where we have students coming into our office, you know, the week before finals, saying, I always had extended time, and now I don't, and I need it. And we need time to process accommodations. So my advice to students is always, if you've had accommodations in the past, be proactive before you come to campus. Get all your documentation to us. We have an application for accommodations, and have those in place. And if you don't want to use them, you don't have to. Just because a student has accommodations doesn't mean that they have to use them. They can have them in place, so if they find themselves crashing and burning without their accommodations, they have something in place should they decide that, you know what, my attentional disorder really is a real disability. It's not something that was something I had to deal with when I was a kid. So I too have my cards, and I have a brochure for disability services, and I will stay for a little bit after if anybody has any questions about our service.
Hi everybody, I'm Mary Fraser. I'm the Director of Student Academic Success Center, and it would be better if I stand, because otherwise my arms, if I have to sit still, my arms will just be I'll gesticulate too much. So, the Student Academic Success Center serves students with academic support services here in Biddeford, on the Portland campus. We also serve our campus in Tangier, and have even worked with students studying abroad, and provided services via Skype and by other methods that way. So we serve any UNE student, right from their first semester up until they complete their residency and become doctors. So how many of you have aspiring doctors or pharmacists among your students? Okay. So you're aware that those programs are competitive. They're really rigorous and demanding, and they demand a lot of your students. And they take a lot out of your students because your students are expected to put a great deal of their time, energy, thought, and just general resources into study for those programs. The courses start out from the very first semester being pretty rigorous, so general chemistry and biology. And we want to make sure that students understand that accessing tutoring and academic support at the university level is not the same thing as they might have experienced at the high school level. Students who come to use our services at UNE are not all students who are struggling or who are not passing their exams, who are failing their courses. Many of those students, in fact most of those students, the majority, are students who want to learn more effectively, learn more efficiently, have to take a little less time, learn strategies that will help them to process and digest the volume of information that they have to master for their major. More easily. So they come to work with professional tutors and peer tutors who have those strategies and have those tips for success that help the students to kind of plow through the obstacles when they present themselves and to discover that they can achieve what they want to do for their major. We provide writing support as well, peer and professional. All of the services are prepaid. They're included in tuition, and this is the same spiel I will give to students tomorrow as well. Prepaid services mean to get the best value for your tuition dollar. You want to use those services to the full extent that you are able to. And so we strongly encourage students to do so. One of the other aspects that the Student Academic Success Center handles is placement testing. Your students just finished that a little while ago if they had to do placement testing. And along with that, we do coursework around building skills to be at the college level in English and in math courses. So I have a flyer that describes some of the additional services, including courses, that students may be registered for as part of their fall semester, so that you have an understanding of what those courses are all about, but also so that you can explain to your students the value of doing that coursework. I think there's a lot of difficulty for students to understand that if they're taking something that doesn't bear credit toward graduation, toward their major, then it doesn't have value. And in fact, particularly for students who are pursuing rigorous majors, it does. It has tremendous value to ensure that they achieve the level of mastery and content that they need, that will be expected of them in college level classes. So some of the things that are described on here, firstly is our ALEX Bridge program. ALEX is a computer software program that students can take series of modules to review and master information in preparation for their fall semester. So if a student has a developmental placement in, say, algebra, they'll be encouraged to do an ALEX program over the summer where they go online at their own pace and go through modules to sort of refresh and build the skills that they will need, that they allow them to accelerate to the next level of math for their program. So it's a good way for them to get through that and to maybe eliminate any developmental classes that they might need, or to at least accelerate them to the next level of that. So there's information about that. There's also information about our chemistry prep class. If you have a student who's going to be in pharmacy or is pre-med or marine science, they'll be enrolled in chemistry in the fall semester. And for a lot of students, chemistry is a gateway course. It's very challenging. It requires a great deal of time and commitment, and students struggle a lot with the math associated with that chemistry. So we have a prep course that goes along with it. It's a companion course that deals specifically with the math around chemistry and provides a structured practice every week for students to do that. So it's a 1-credit course. It's very easy to slot right into a student's schedule. So there's information about that as well. Our office also provides learning specialist services. We have professional staff who are trained in helping students to understand their learning style, to understand different strategies and approaches for different material and how they can adjust the study habits they have formed up to now. Hopefully they have some study habits by the time they get here. But we'll work with them on making those informed decisions about ways that they can try studying a little bit differently, studying more, talking to them about the kind of studying that they should be doing, and so learning specialists are available for students to meet with as well. I will also hang around for a few minutes after if anybody has particular questions. I finished gesticulating.
I'm Jane McCabe, and I'm the Clinical Director for Student Counseling Services. We have counseling services for students on this campus and on the other campus as well, in Portland. We're open 8:30 to 4:30, but we're on call at night and on the weekend as well. We are located in Pets as well, but we have our own entrance at the top level on the left-hand side, so it's private and people can kind of slip in if they do not want others to know that they're there. We see students from their having transition issues to the time when they're getting ready to graduate and freak out because they have to get out in the real world. We see them for personal problems. We see them because they have had issues when they were at home or that were maybe better managed there. And so it's kind of overwhelming, when they come to school. We get referrals from these folks. We get referrals from faculty, also the residence life staff, etc. Regarding the residence life, I might say something that would probably be useful to you, and that is that if you have a concern about your student, you're quite worried, you haven't heard in who knows how long, then you can give us a call. We will have a discrete wellness check done. We will get back in touch with you if that student is at risk, but not otherwise. So the good news is, you know, that you don't need to be concerned. You know, you would be informed if you were the emergency contact and the student was in jeopardy in some way. We do not release information to others that the student has not signed a release for. That includes parents. And sometimes parents get quite upset because you're paying the freight here, etc. But it's really about they're 18, or at least almost all of them are. And so it's really up to them. You may think that they should come to see us. Others may think so too, but they may not be ready. And we do not chase them down. So we wait for them to initiate it because it works better. We don't do mandated counseling. It's free and it's confidential. Well, it's prepaid. It's prepaid. You know.
No extra.
We don't have session limits, and I have both male and female counselors. I have something for you. If you didn't get this at Accepted Students Day, you can pick one of these up on the way out. This is a website that has articles for students and also for parents. And on the back, we have these neat little things about important numbers. So you don't have to go looking them up in a crisis situation. And our number is, of course, on there. We're part of Student Support Services, and that includes all of our services, and we do make referrals back and forth, but we do it with releases signed. So it's, we sometimes also have to wait for students to come to see us, and I would say we always encourage them to come early rather than late. It's better that they not fall off their perch in line with themselves in the bottom of the cage with their feet in the air before they actually get to us. And it's never too late, however. So if we need to deal with hospitalization, which is on occasion we do, then the person who is the emergency contact would be involved. It is my preference that if we are hospitalizing somebody from counseling services, that the student call the parent or the emergency contact themselves in my office so that everybody's on the same page. Okay, I think I've said most everything, right? I usually forget some detail, but... Yes. We have the psych nurse practitioner in the health center, and we make referrals for med management and also for evaluation for medication. As you may know, the reason that most students across the country seek counseling services is anxiety or symptoms that fit with that. The next one is depression. You get too much anxiety, you get exhausted, you get depressed. So, what we do when we think that a student is ready, we have the releases signed, we send them down to meet with the health center and then perhaps get referred to the psych nurse practitioner for medication. Students don't always want that, and that's fine. We tell them that we'd be happy to work with them, but it will be more effective if we use the resources that they have, signed up for. I'll be here also for a few moments afterward in case anyone has any particular questions. Welcome.
We have about 5 minutes for general questions if folks have any.
Where do the forms go to? Your office? These health
Oh, the health
forms?
forms? Yes, they go to our office.
Okay.
They can be mailed or faxed.
Can they be mailed?
They can be mailed or faxed.
Okay, you need all three of these, the physical form filled out,
Yep, by the doctor,
right?
and then
this.
physical, signed and dated. That's a health history form that the student can do with you by themselves.
Okay.
And the
The
immunization.
immunization, the doctor fills out.
Right, and the The extent to which that goes depends on whether the student is in the College of Arts and Sciences
Right,
or if they're in health professionals. There are two
okay, I see
different
that,
ones.
okay, so either or,
Yep, whatever program you're in. Okay.
and that goes to you.
Right.
And there's a question up here.
Oh, second, sorry.
Sure.
Oh, just a quick question. I got in the last physical signed by the provider, but do they also have to, the provider also have to sign your form?
The immunization form.
Just even if I got the immunization form with the
Attached.
last physical?
Oh, you have it with it?
Yeah.
Oh, that's okay.
That's not from me.
That's basically the same question, so the printout that the doctor gives with the
Yes,
physical
that's
stuff.
fine. Comes off their electronic
Leave it off,
medical
yeah.
record. If it comes off their electronic health record, yes, it's fine. Yep.
Those forms online, I was not in the room when you started talking.
The forms are all online, all on our webpage,
Okay, thank you.
and they're pretty self-explanatory. And then there's a checklist too that goes with it, and it'll just say, did you do this, did you do this, did you do this? It's really kind of nice because it helps you organize all those things and where they're supposed to go and that sort of thing. So. And we also have on the website, and I thought of that when somebody mentioned age, if your student is going to come to the University of New England before their 18th birthday, there is a form online to give a medical release until they turn 18, so that if they need to come and see us, we don't have to call you. Okay, so it's right online.
How do we know if we've given you everything that you need?
If you haven't, you'll hear from us.
But will you let the student know, or will you let the parents know?
We usually let the student know. We communicate directly with the student. And I, you know.
So again, how do we know?
So you might want to have that talk with them. Like, if you hear from Student Health Services, don't ignore it. So,
I was thinking part to that question. If they're playing sports, they have to get a polio test, correct?
sickle
Do you
cell,
offer that type of
sickle cell.
sickle cell, I'm sorry,
Yeah.
yeah, that's what it is. Do you offer that type of service in the health center?
We can draw the blood. Usually they come with it done.
Okay,
Yeah,
so this should be in place before they.
right.
Okay.
I'm sorry. Somebody else had a
Were
question.
those forms in the orientation packet that the kids got?
No, they
The health
usually don't
forms?
come, the forms, the actual forms don't come in there. They're actually on our webpage.
Oh, okay.
Those forms were due, is it July 1st?
July 1st.
If they don't have their physical till after, can you send everything in the old, like the one that was good from January, July 1st? Can we send that in and then send a new one in after?
Yes,
All right.
absolutely.
Oh, almost. And does it say which mandatory shots they need?
It does.
It does.
And in most cases, your child probably has had them all.
Isn't there some just like, they get kind of just for college?
The only one that we require that isn't usually part of a standard childhood immunization program is meningococcal. But that is becoming more common to have that administered in late childhood, teenage years in high school because it has become a problem at that level as well. But that is required by the University of New England, the meningitis vaccine.
Excellent, thank you. Our presenters will stick around for a few minutes if people have specific questions.